Well, good morning, everyone, and thank you all for being here for our 2026 Nursing Awards ceremony. So this ceremony is such an exciting one as we get the privilege and to acknowledge our hardworking nurses. So thank you all for taking time to be here today to celebrate our nurses, their wonderful accomplishments, and we look forward to having a great program. Right now, I'd like to introduce our Associate Director for Patient Care Services, Mr. Garrett Schreier, to the podium, and he'll provide our opening introduction. So please welcome him.
Ooh, room got full. Good morning, guys. It is awesome for me to be able to be here with you guys today. For me, I can't tell you how much it means for me to be able to be here and participate in this and celebrate alongside you guys. For those of you that don't know, I am currently on a detail and I've been gone for 7 weeks. So I got to come back this week and hoop and holler with you guys today. And I am so thankful that Natalie has stepped up and she is acting as your ADPCS during this time and of course doing an absolutely wonderful job. Recently, I have gotten the opportunity to participate in 2 other of these events at different hospitals in Vision 6, where I'm currently working as the CNO. And I can tell you by our agenda, as with everything, Cleveland is doing a much better job. And they were wonderful events, and I'm not going to name the hospitals, but I will tell you, Cleveland, specifically nursing, is always at a whole nother level, and it is because of each and every one of you. It is not because of me, it is not because of Natalie, it's not because of any one specific person. It's because of each and every one of you and your continual strive for excellence in everything you do. And there is no way ever that I can tell you thank you enough. And I don't think that our veterans can ever tell us enough, but they do, don't they? They continually thank us for the care that they get and the treatment that they get from y'all. And I just, again, thank you. I am thankful that I do not and did not have to participate in the judging of the art. I have kept hearing how great this art is, and I got to walk around today and look at them. It is absolutely amazing, and how, again, the talent that we have here at this facility blows me away. So, again, thank you for letting me be here, and thank you for letting me participate. Thank you for everything you guys do each and every day. And it is just awesome to see all of you here and participating. So without further ado, let's get on with it. Thank you.
Next, we will have our chaplain, Rachel Davidson. She will lead us in an opening blessing.
Hi, everyone. My name is Rachel Davidson. I'm one of our chaplains here, and it is my honor to be with you all today, and it's my honor to serve alongside all of you every day in this medical center. While chaplains are here to provide spiritual support, I know that each and every day, each of you enlivens the spirits of the people you care for. You don't just care for people's bodies, you care for their hearts and their whole selves. I want to celebrate the sacredness of all of your work. We all probably come from different traditions, different religious and spiritual backgrounds, but all of us are united in our desire to serve those who serve. So today, I would like to offer you all a blessing. If you'd like, you're welcome to put your hands out like this, and you're welcome to close your eyes or leave them open as is comfortable for you. May each of you who works so hard to serve our veterans be blessed with joy and strength each day. May your hands that work tirelessly to care for those who are sick and in need receive the blessing of comfort, healing, and wholeness. And may your hearts that care so deeply for each person you meet also receive joy and love each day here. Each of you is a blessing, and we are so glad to have you. May you be blessed this year.
All right, so it's me again. It's really quiet in here, but we're gonna have a little more sound soon. So I'll introduce myself for those who may not know me. My name is Katrina Kelly. I am one of the nurse recruiters, staff, and coordinators here, and I will serve as your moderator today. So again, we'd like to welcome everyone and thank you all for joining us as we get the opportunity to celebrate advancing nursing and transforming healthcare, and then how that reflects to and translates to the power of nurses. So that's really awesome. Before we begin, I just want to provide a few instructions. So for our award winners, when your name is announced, please come up. You'll meet over here. You'll get your lovely award. And then if you wouldn't mind standing off to the side for a moment, at the end of the awards presentation for your particular section, we're going to do a group photo. If you are just such a great nurse, which I know you all are, you may be called twice. Your name may be called twice. And so if you get 2 awards or your name is called twice, please note you'll get 1 award, but please bring your other one up here so you can have it for the photo op, okay? And so I think those are my 2 things that I wanted to share with you all. Our next presenter, we have Miss Mona Pruitt. She is a nursing assistant here in acute care, and she is here to deliver a powerful Nurses Week tribute. So please welcome her.
Greetings to all. It's truly an honor to stand before you during Nursing Week, a time when we recognize not only profession, but a calling. Today I'm going to talk about four things: our knowledge versus our experience, our professional standards, our sacrifice, and our position at the center of change. Our knowledge versus experience. A student nurse. As a student nurse, I stand in a unique space. I'm still learning, still studying, still practicing my clinical judgment. But I am also witnessing firsthand the extraordinary responsibility that comes with this profession. Before entering nursing school, I had over 2 decades in healthcare. I have worked closely with patients in direct care roles, and I have seen what nursing looks like from the outside. I have watched nurses manage complex cases, advocate fiercely for their patients, educate families, and remain calm in moments of crisis. Now as a student nurse transitioning towards becoming a registered nurse, I see it from the inside. And what I see, nursing is a science and skill, but it's also a discernment. It is a policy and a protocol, but it's also presence. It is medication, administration, assessments, but it's also advocates for voices. In clinicals, we are taught that nursing starts with airway, breathing, circulation. But it also includes safety, infection control, documentation, and evidence of best practice. What I am learning beyond the textbook is nurses are often the last line of defense between vulnerability and harm. We are the ones who recognize change in condition. We are the ones who speak up when something does not look right. And sometimes the voice can save a life. We are the ones who ensure a patient is not discharged, but discharged safely, safe to go home, safe in their own environment, safe in their understanding of their medication, safe in the follow-up of care. Our professional standards. As a student nurse, I have learned that critical thinking is not optional. It is a foundation. Every assessment, every dosage calculation, every interaction matters. In school, we practice dimension analysis, We practice S-bar communication. We practice prioritization. But in real life, we practice humanity. We practice listening when someone's afraid. We practice dignity when someone feels embarrassed. We practice patience when someone is confused. And we practice, obviously, when someone cannot speak for themselves. Nursing Week reminds me of this profession as being built by a generation of leaders who believed in both excellence and equality. Florence Nightingale professionalized nursing. Mary Elizabeth Mahoney broke racial barriers in nursing. Countless nursing since then have expanded the profession into research, advanced practice, community health, mental health, public policy, and beyond. And now, as a student nurse, we are part of the roots. We carry the responsibility to uphold standards. We carry the responsibility to continue learning. As we carry the responsibility to protect the integrity of this profession, our sacrifice. For me personally, returning to school later in life was not easy. Balancing my family, work, studying, exams, and clinical rotations require discipline and sacrifice. It also required purpose. And my why has always been clear: to help people, to advocate for those who may not understand the system, to ensure the patients are treated not just diagnosed, but like a human being. Nursing has taught me that technical skills must always be matched with emotional intelligence. It is not enough to be competent. We must be passionate. It is not enough to follow orders. We must think critically. It is not enough to complete tasks. We must build trust. We are nurses in the center of change. As student nurses, during this nursing week, we stand at the doorway of responsibility. We are preparing to enter a profession that is demanding, involving, and essential. Healthcare is changing, technology is advancing, and patients' population are aging. Health gaps remain real. And nurses will continue to be the center of that change. So during this nursing week, I celebrate the nurse who stays late to make sure a patient is stable, the nurse who mentors a student, the nurse who speaks up in a difficult situation, the nurse who comforts a family member at 2 a.m., the nurse who teaches, leads, learns, and encourages. Today, I celebrate my fellow student nurses. We stand late, practice skills repeatedly, ask questions, and choose growth over comfort. Because becoming a nurse, it is not accidental, it's intentionally. And excellence is necessary and not inherited. It is a development, one shift, one lesson, one patient at a time. Thank you to every nurse who has modeled professionalism, integrity, and compassion. And to the fellow student nurses, we must be committed, stay curious, stay grounded in our purpose, and the future of nursing is somewhere not far away. It is being built right now in classrooms, in labs, in clinical rotation by dedicated student nurses who continue to rise, learn, and serve. Happy Nurses Week. Thank you.
That was amazing. Thank you. Thank you so much. So we'll now shift to our awards portion of the ceremony. So please welcome Elizabeth Edmondson, our interim chief nurse of ambulatory care and chief nurse scientist, and she will present the Secretary Awards.
Hello, everyone. This year, I had the privilege of chairing the committee to select our Secretary Awards for Nursing Excellence. So a little background on this award. The VA Secretary's Awards in Nursing Excellence Program, established in 1984, annually honors one medical center director, one nurse executive, a registered nurse in a staff role, a registered nurse in a non-staff nurse role, such as an APRN, nurse manager, instructor, etc., a licensed practical nurse, and one NA actively engaged in the care of patients at a VA medical center. The recipient's contributions to the care of patients in any VA healthcare setting are patient-driven and demonstrate such excellence as to merit recognition from peers. This award is given only once to an individual. So starting with this year's Secretary Award for Excellence in Nursing, Nursing Assistant, Healthcare Technician role, I'd like to congratulate Courtney Studemeyer-Smith. So Ms. Studemeyer-Smith has significantly improved patient care through her role as a subject matter expert in fall prevention. She proactively identified the need for focused fall prevention efforts and committed herself to this initiative. After attending an 8-hour falls prevention boot camp and age-friendly training, she applied her knowledge to enhance safety practices on Coral Cove. Her efforts have led to improved fall prevention interventions and consistent use of mobility screenings, directly benefiting the veterans in her care. Ms. Studemeyer-Smith collaborates closely with RNs, LPNs, fellow NAs, medical providers, physical and occupational therapists, and dietitians. She actively participates in team autumn meetings, contributing to interdisciplinary discussions and helping develop personalized interventions for residents with recurrent falls. Courtney's dedication has earned her praise from peers, providers, and the hospital's fall coordinator. Her leadership, initiative, and commitment to excellence in fall and injury prevention have made her a respected and valued member of her team. Her efforts have not only improved care, but also fostered a culture of safety and accountability. So congratulations, Courtney. So for our next category, which is the licensed practical nurse role, I'd like to congratulate Jason Monk. I think Jason's not here, but I'm going to talk about why he was selected. So this year, Jason has become an indispensable member of the podiatry team, caring for high-risk veterans with diabetic foot conditions and complex wound needs. Over the past year, he has consistently gone above and beyond to ensure veterans receive timely, high-quality care, volunteering to travel across multiple community-based outpatient clinics to maintain critical access during staffing shortages. Through this selfless dedication, Jason has helped preserve continuity of care, improved patient satisfaction, and reduced unnecessary community care utilization, all while earning the deep respect and admiration of the veterans he serves. Jason leads with humility, teamwork, and an unwavering focus on service. He truly embodies the very best of nursing and the mission of the VA. So we congratulate Jason. So for our next category, the Secretary's Award for Nursing Excellence, Registered Nurse Staff Role, I'd like to congratulate Julie Nuns, who is also not here. So with more than 15 years of nursing experience and extensive expertise in hospice and palliative care, Julie serves as a registered nurse on Heroes Harbor, the inpatient hospice unit at the Cleveland VA Medical Center. Julie exemplifies expert nursing practice each and every day through her mentorship, advocacy, and commitment to lifelong learning. She is a trusted preceptor for new nurses and post-baccalaureate nurse residents, generously sharing her knowledge and fostering professional growth among her colleagues. Through innovative educational initiatives such as the Wound Word of the Day board and her leadership within the Slough Slayers Pressure Entry Prevention Team, Julie has elevated staff knowledge and strengthened quality of care provided to the veterans at end of life. Her kindness, integrity, and quiet leadership have shaped the culture of Heroes Harbor and inspired countless colleagues to pursue excellence in hospice and wound care. Julie may prefer to remain behind the scenes, but her influence is seen every day in the comfort, safety, and dignity experienced by the veterans and families she served. So congratulations, Julie. And lastly, the Secretary's Award for Nursing Excellence in the Expanded Role. I'd like to congratulate Bridget Wassel. Here she is. So for the past 8 years, Bridget has served as the nurse manager of Heroes Harbor, our inpatient hospice unit, leading with compassion, clinical expertise, and an unwavering commitment to veteran-centered care. As a respected leader, mentor, and advocate, she created a culture where dignity, comfort, and holistic healing guided every interaction. Bridget's influence can be seen in the meaningful experiences she helps create for veterans and their families, from honoring final wishes and milestone celebrations to implementing innovative, evidence-based approaches that improve comfort and quality of life at the end of life. Her leadership has advanced hospice and palliative care practices through staff education, interdisciplinary collaboration, and innovative interventions such as weighted blankets, aromatherapy, Reiki, and the implementation of the Macy catheter program to improve symptom management and comfort for dying patients. Bridget's dedication to nursing excellence extends far beyond the bedside. She has authored scholarly work focused on hospice nursing education and symptom management, mentors staff in evidence-based practice, and champions professional development and specialty certification among her team. Her leadership has directly contributed to exceptional quality outcomes, including over 600 days without a hospital-acquired pressure injury on the unit. Colleagues describe her as a steadfast source of guidance, compassion, and support, someone who leads by example and treats every veteran as family. Through her integrity, innovation, and deep commitment to both veterans and staff, Bridget truly embodies the spirit of nursing excellence and the values we celebrate during Nurses Week. So, thank you, Bridget.
All right. So congratulations. All right. So our next award, we will welcome Mary Pat Bugay, and Chief Nurse of Surgery, and Nicholas Nagel, Nurse Manager, PACU IR Radiation Oncology, to present our Florence Nightingale winners.
Yeah, thank you. Good morning, everyone. The Florence Nightingale Award is a distinguished and meaningful honor. It includes nurses from both the medical center and our outpatient clinics. And in particular, it's particularly special because it is, the recipients are nominated by those coworkers on their units. So it is a coworker nominated individual. Nominees are identified as individuals who exemplify nursing excellence and inspire future generations of exceptional nurses who will follow in their footsteps. Being nominated by your colleagues is a remarkable accomplishment of your dedication and impact. Please take pride in the examples you set every day. As your names are announced, we ask you, you're going to receive an award. We ask all of those present that receive the award to stay up here also afterwards for a group picture.
So she gave me the hard job.
The names.
Yes. We ask that we hold applause until everybody's announced. Alexis Filigali. Alicia Smith. Arnie DeMarco. Catherine Crawford Hales. Cheryl Malik. Janet Nickel. Janice Tench. Jolena Venn. Kathleen Overy. Caitlin Pavlik. Leeler Powell. Lisa Weber. Marissa Parrott. Ruth Gilbert. Samantha Krupa. Sharia Matthews. Teresa Brewer. Teresa Bellion. Oh, Balon. Sorry. Stephanie Wills. So that was page 1. We can clap. On to page 2. Amber Pierce Smith. Amy Sarge. Andrew Camaris. Anita Lacey. Aristotle Manjic. Barb Sloan. Oh. Carl Steinoff. Cheryl Nash Brown. Christine Hurd Clem. Danny Del Rio. Dolores Fluker.
You said no.
We can clap again. If we wait too long, Jose is going to come up and say a joke, so please.
Go faster.
I didn't say a funny joke.
You said Jose, so it wouldn't be fun.
Yes. Diane Owens Hall. Felicia Douglas. George Basica. Jody Snyder. John Knight. Joshua Suba. Karen Shazinski. Kelly Peters, Kim Brown, Laura Britt, Laura Sika, Linda Gemma, Lisa Nixon. That was page 2. We can clap again. Marianne Reagan, Mary Jo Ashdown, Mary Morgan, Miranda Sorka, Nikki Shuri, Portia Bishop, Ronald Dixon, Rudy Pekovic, Sarah McCann, Sarah Kirshner, Shelley Johns, Shirley McNeil, Sanjazna Elshaw, Tanya Cox, Tiffany McHugh, Tracy Greathouse, Veronica Miller, and Vivian Fenrick. All right, now we can hoop and holler and applaud. Congratulations to all the awardees. If you will come up for a group picture with Garrett and Natalie.
We're going to test the limits of a wide-angle lens. Try to make a second row so you're in between. You're making a third row. Come on over here. Come on over here. Okay, two rows. So for the second row, make sure you're between the people in front of you.
I can't see him.
All right, now squeeze in like sardines.
A little short. All right. So our next awards presentation will highlight the Innovators Network, such as some of our Spark Seed spread projects and local innovations. So please welcome Kimberly Diaz, Chief Nurse of Spinal Cord Injury, and Catherine Wilson, Assistant Chief, CLC, who will present our next award winners.
Hello, everyone. So the Innovators Network, also known as INET, is a bustling community of employees united by the desire to solve healthcare problems and engaged in shared learning. The Spark Seed Spread Innovation Investment Program seeks to identify and accelerate employee-inspired innovations that improve health experiences for veterans, families, caregivers, and employees.
These next acknowledgments and awards recognize our local employees who are currently involved in the Spark Seed Spread Innovation Program. We would like to recognize them for their creativity, initiative, and innovation. It takes a healthy amount of passion to drive and desire to bring forth the idea and put action behind the idea to make it a reality. Their involvement represents the power that nurses have in advancing nursing and transforming healthcare technology. Like before, when we call you guys up, just stand to the side and wait for your group picture.
All right, first up we have Kimberly David-Saver, Leslie Andrews, Mary Ellen Desmond, and they're being acknowledged for the Education Suite Solution.
Next is Pamela Lemke, Amber Pierce Smith for the blood pressure armrest.
Next, we have Lydia Dowell for the user by printer project.
Next, we have Shawnee Fox, Chastity Doherty, Brenda Richardson for the Operation Vet Bank.
Next, we have Beta Varga, Shannon Middlebrun for the sleep restoration program or project.
Next, we have Marlon Jones for Map Tray.
Next, we have Donna Rosen for the door sign project. You got this.
We have Samia Benadala and Elise Jacobs for the Jerry Cart.
Right here, yep. Okay.
Go together, Elise. Go, go. She looks so cute today.
And lastly, we have Allison Hess for the staff image capture.
Group picture time.
Thank you, everyone.
Thank you.
Right. So next, please welcome Emily Tavitzi. She's our interim chief nurse scientist. She'll present our quality improvement lead projects and quality improvement nurse graduates.
To bring this down. Hi, everyone. My name is Emily Tavitzi. Today I'll be recognizing the following individuals who have completed the QI nurse program. Before I announce the graduates, though, I'd like to share a little bit about the program. The QI nurse program is a 12-month program that aims to empower nurses with the knowledge, confidence, and skills needed to complete and lead QI projects. The program develops these nurses as quality improvement champions and encourages and assists them with projects across various areas of VA Northeast Ohio healthcare system. The program also fosters a positive project culture here in our facility. The curriculum includes 20 hours completing the Institute for Healthcare Improvement IHI modules. The QI nurses then create a project using the IHI model for improvement with mentorship and support from the Quality Nurse Council and the Chief Nurse Scientist. Their projects then highlight their work, where they complete a poster and get a certificate of completion. The benefits of this program include the opportunity to present at the VA Northeast Ohio Council across the facility, submitting abstracts for a poster, publishing in a journal, and more. Using quality improvement experience can be added to your resume, and providing this education helps nurses become leaders in quality improvement on their unit. The QI nurse graduates for this year worked extremely hard on various projects across VA Northeast Ohio, spanning various interdisciplinary departments and clinical specialties. Their work and dedication to continued learning and advancing improvement efforts across the VA is inspiring, and I'm privileged to have them as colleagues. Graduates, once your name is called, please come to the podium to receive your certificate and pin. Our first QI nurse graduate is Jody O'Neill for her project titled Safe Handling of Body Fluids Following Cancer Treatment, Protecting Yourself and Others in the Cleveland VA CLC. Next, we have Michelle Campbell, Leanne Kaminsky, Katrina Kelly, and Susie Maddock for their project, Customer Service Implementation to Improve the Onboarding Process of External Hires. Next, we have Samantha Kazin for her project, I Share Boards, promoting ideas to standardize healthcare activities and reduce errors. Next, we have Leslie Andrews, Marielle Desmond, and Kim David Saver for their project, Moving the Needle on Timely Mealtime Insulin Administration.
You guys get a second opportunity because the first one didn't turn out. Thanks for everything you do.
Next, we have Shawnee Fox for her project, Planting the Seed, a therapeutic gardening program pilot in veterans with long-term spinal cord injuries. Next, we have Lance Britton and Corey French for their project, Cleveland Clothing Closet, a nurse-led emergency department initiative. All right, next we have Dante Atanato for his project, Improving Data Entry for EKG Compliance in the Emergency Department, a nurse-led quality improvement initiative. We have another ED project, Dustin Glass, Michelle Mikovic, and Dante Atanato for their project, Reducing Blood Culture Contamination Rates in the Emergency Department. In our final group, we have Callie Regan, Nina Holopeter, Jeffrey DeCrosta, Andrea Sawyer, Anthony Mendoza, and Latoya Eppinger for their project, Improving Handoff from the Operating Room to the PACU. Thank you very much.
Really resonating with me hearing those projects, all direct impact to veterans, quality of life for veterans.
All right. Our next award. Oh, so sorry. I'm just moving us along. I'll hold.
Nice try, ladies. Let's go. Nice try.
Right. For our next award, please welcome Nancy Sikra, our Chief Nurse of Education, to present our evidence-based practice projects. She will also then introduce our RNTTP program and PBR&R program presenters when she's finished.
Thanks, Katrina. Good morning, everyone. I have the honor of presenting 4 projects today on evidence-based practice projects. Evidence-based practice in nursing projects involves using the best available research evidence to improve patient care. These projects often focus on identifying a clinical problem, searching for and critically appraising relevant research, implementing interventions, evaluating outcomes, and disseminating findings to improve nursing practice. The first project I'd like to present, I will call the names and then tell you the name of the project. So Tina Vandertheer, Bunda Russ, Rex Thomas, Eric Kennedy, Tashia Allen, Barbara Foland, and Jolie Gaga. They are an RNTTP group, and their project was using the implementation of barrier cream for CLC residents to prevent pressure injuries. These guys graduate tomorrow from the program, too. The next project is from our fall cohort TTPs, Transition to Practice, and Amanda Geiser, Brittany Green, Chantrell Turner, Samantha Yurko, Kristen Boone, Lanisha Jackson, Zoe Field, Lindsay Eckstein, and Amela Churn. Their project, Brittany has made it, and their project is use of standardized Q2-hour turn visual aid to prevent pressure injuries in veterans with spinal cord injury. The next project is from our post-baccalaureate registered nurse residents. So I'd like to call Todd Johnson, Riley Stopp, Morgan King, Emma Estevez, Ruva Nedlovu, and Lily Wojcik. And their project is using aromatherapy to reduce pain and anxiety in orthopedic veterans before physical therapy appointments. And the last evidence-based practice project is Lance Britton, Dustin Glass, and Dr. Gerald Maloney, improving the trauma triage process in the emergency room, a VA Northeast Ohio Healthcare System nurse-led EBP initiative. Thank you, everyone. Come on up.
Did you see the residents' face when you were reading them off? Their faces were like.
You can scoot down this way a little bit, even, guys. You're all in the corner. And now I have the pleasure of introducing Dr. Marianne Lawler, who will tell you more about transition to practice.
All right, good morning, everyone. I'm so excited to be here, and I am currently the acting Transition to Practice Program Director. It is so much fun to have these residents and watch them grow and find places here in the medical center to work. But I'm just here today to tell you a little bit about the program. RNTTP is a 12-month comprehensive program that builds on clinical, leadership, and professional dimensions. The TTP program is managed by the Department of Nursing Education, and this structure allows the residents to participate in all of our classes and supplemental activities while they continue to build on their clinical skills. We onboard 2 cohorts per year, one in the spring and one in the fall, and during their program, they're expected to complete an evidence-based practice project, like you heard. We would like to take a moment to recognize them again, and I'm going to have them come back up again just to embarrass them because they are graduating tomorrow. So a huge round of applause when they come up for Tina Vathier, Barbie Foland, Boonda Russ, Rex Thomas, Tashaya Allen, Jolie Gaga, and Eric Kennedy as our spring cohort graduates. And so the 3 graduates you see up here, Rex and Boonda, will both be working on 4B, and Tina will be working in home-based primary care starting on the 18th. All right, so I'm going to go ahead and introduce Dr. Laura Goliad, and she is the PBR&R Program Director, and she'll tell you a little bit about how that program differs from the TTP.
Thanks, Marianne. Good morning, everyone. It's great to see everyone, and Happy Nurses Week, Happy Nurses Month. I have the privilege of overseeing the post-baccalaureate registered nurse residency program, PBR&R. So they were not aware of this recognition today, so it's a beautiful surprise for them. A little bit about the background, and then as Marianne said, we'll call them up to the front with me, embarrass them a little, but in the best way. PBR&R program was developed for newly licensed RNs in their first role after graduating from a baccalaureate or master's entry into nursing practice degree, with 100% protected time during a 1-year-long residency program aimed to enhance new graduate RN clinical competency, competence in practice, and leadership skills. VA Northeast Ohio Health Systems PBR&R mission. The mission of the PBR&R program is to provide new baccalaureate nurses with a 1-year smooth transition to practice training program that incorporates robust clinical and didactic experiences that facilitate role socialization, clinical competence, interdisciplinary collaboration skills, and confidence to practice independently while equipping them with the level of preparation needed to deliver the high-quality care to the nation's heroes, our veterans. I want to take this opportunity to thank you all for your support of the PBR&Rs. It's very much appreciated, and they're growing in leaps and bounds. We have, again, been blessed with 6 exceptional nurses. And I'd like to call the 2025-2026 PBR&R cohort up to join us here in the front. Emma Estefes, Todd Johnson, Morgan King, Ruva Noloviu, Riley Stopp, and Lily Wojcik. I'd like to take a moment to highlight, applause please, thank you. I know they thank you too. A few of their accomplishments thus far in the program. As far as publication, they were published this month in the May 2026 issue of the American Nurses Association Ohio Nurse News Journal. It's a very interesting publication because they have chosen to celebrate preceptors. So it's all about their wonderful experiences with you in whatever preceptor role, supportive role you played. So it's in this issue, and it's called The Lasting Impact of Nurse Preceptors, Helping Residents Today So They Can Help Patients Tomorrow. This is a celebratory tribute to nursing preceptors. Couple more areas. They're currently working with Andrea Jennings in a patient education resource center project and putting on many health fairs for veterans of some hot topics and some needed topics. So you'll see them outside the canteen at various times to educate the veterans. They did go down to the Ohio League of Nursing and they presented their poster, The Art of Close-Looking Immersion, Integrating Visual Thinking Strategies for New Graduated Nurses. That was an invited presentation and they presented on behalf of their experiences here. But I would also like, and lastly to add, they were winners of the poster contest in their category in Columbus, Ohio, statewide. So thank you to our PBR&Rs. Thank you to all of you for your support. Congratulations and happy Nurses Week and Month.
All right. We are nearing the end, but we're not there yet. We have one more for you. All right, so this year we had a very unique and fun activity that asked our staff to show us your heart through creating heart art, which you see on display here on either side of the room. I'm gonna ask that we welcome our acute care nurse managers, Rachel Jaba and Evelyn Niebowitz, to announce the winners. Thank you.
Happy Nurses Week, everyone. I want to say that this project that went on, or this artwork, was very close to my heart. It was amazing how every nurse from the C-box, from the clinics, from outpatient, from acute care, from CLC, how everybody was just so, like when we said, okay, pick up your canvases, my teams was like, we're going to get it. So it was just beautiful that I've met so many different people that I knew the names, but then I get to see them. So I want to start with, before I know you guys want to know the winners, because people were asking me last night at 10 o'clock who won. No, okay, so we know who won. But let me just say to you guys that some of them, when they came to my office and people brought them to me, the stories that were told about this artwork, like it could bring tears to my eyes, to be honest with you. So like one of them, Midtown Dialysis. I'm just gonna grab it. So let me come back to here. So Midtown Dialysis said to me, you know, they just said, okay, we gave one direction. Something with heart, you know, have anything you could do, use whatever medium you want to use. Everybody just came, they're so different and they're so great. So they told me, the story on this is they lost one of their coworkers this year, and this stethoscope up in the corner is from him. They honored someone in their unit that meant something. This means something to them. This is artwork that should be hung in this facility so we can always see it. So another one that I thought was so creative, okay, and I know it was for me, like this is what I see. So ER, so if you look at ER, you might not understand it, but they're going from the door to balloon within 90 minutes, and those are 90 hearts on those things. So, like, I would love to sit here all day, and I know everybody's got to get back to work. I could tell you a story about each one, and I just picked 2 of them that, just so you know, I could tell you something because people shared. Everybody I met was gracious and just has something to say. So please, if you have not looked, please just look at them. And it gave so much, people have so much talent here and so much love for our veterans, and you can see it in the artwork. You can see it. So just please enjoy it. We're gonna start. We did 3 winners, okay? So 3rd place goes to hospice.
Yeah.
We'll hand it to you. If you're here, please come up. Perfect. That does help me. All right. 2nd place is urology. All right. First place. But I want to say something about the voting, okay? So go ahead, Rachel.
So
Rachel's going to say.
not only was this so engaging, the voting made it fun too. There was 385 people who voted, and that's huge engagement, and that went out to everybody. So let's keep that momentum for Pathways, right? So we decided on 2 first place winners because there was just so many votes for both of these. We felt they both deserved honor mention for that. So,
All right, spinal cord injury.
yay!
If somebody wants to come up. You pull it up in the middle. Hello, thank you. And the other first place winner is surgery. I don't know who's coming up. Oh, I was supposed to go get surgeries. I forgot. It was my job to go get surgeries. And I want to thank everybody. They're all beautiful. We could have made them all winners, but these are the top votes. And thank you very much for everybody, and everybody have a happy Nurses Week.
All right. So we are at the closing of our program. Please welcome Natalie Palmieri, our Interim Associate Director for Patient Care Services, to provide our closing remarks.
All right, guys, what an event. First, I want to make sure we congratulate our nurse recruiters who just did such a phenomenal job planning today's event and so much during Nurses Week. So thank you guys so much. It's a wonderful event. And also to all of our honorees today, really just giving us so many reasons to get together and celebrate, giving us the substance of why we have Nurses Week, why we're here today, all the wonderful things you're doing, the care that you show, the contributions to evidence-based practice. You know, it's such a wonderful way to culminate Nurses Week, and just the sense I get coming out of this week and out of today is an immense sense of personal gratitude. It's not just for you know, what you do for our veterans. I mean, obviously it's a huge thing, what you do for the veterans, what you do for each other, but honestly, every day I come to work and I'm inspired. And that's huge. Like even today, Ilona, with your comments, just so inspiring. I don't even, like everybody I know is like, I can't believe you love your job. I don't know many people who love your job. This is why. Like, this is why. It's the extraordinary is ordinary and vice versa in nursing. I know, Garrett, you said in the beginning that we don't always get the thanks for our veterans, but I wanted to add this in today before we close. So Ashley Mathau, our chief nurse of mental health nursing. So I got an email this morning, a bunch of us did in leadership, sharing kudos that a veteran had shared regarding his care on CT6, which is our inpatient mental health floor. I'm just going to read it. It's one of the most touching and moving kudos I've ever seen from a veteran. So let me find that here. It really went out to the entire CT6 team, but I just wanted to share it because, one, congratulating that team for everything they do, but I think it represents what nursing does and what VA nursing does really well. So this veteran wrote, "Thank you. You all helped me during my time here. Your kindness reminds me to be kind to myself. Your lack of judgment let me feel safe. Your care soothed my soul and calmed my heart. I believe that knowing there is this safe space for me to find refuge in when life gets hard will make life a little easier." And again, I can't think of a more beautiful way to end Nurses Week and sharing those words, because it's the work that CT6 nurse team did, but also just the work that we do as nursing, as VA nursing. So again, congratulations to you all. Happy Nurses Week. Thank you.
Well, that concludes our program. We thank you so much for joining us today.